Welcome to the Health Promotion Framework video. You'll be able to utilize this framework to understand what actions you need to take to promote healthy living as an individual, up to the wider community, and even changing policies and legislations to potentially impact many populations. Firstly, what is health promotion? Well, basically, in order for people to live a healthy lifestyle, they need to be educated about what healthy living is. Also, learning about where to get help in order to make healthy living in your own authentic environment. And so now you understand what health promotion is. Let's have a look at the framework. What is the framework for health promotion? Firstly, let's get some background information. This framework was created and published by authors Murphy and Kelher in the year 2003 in Oxford, England. This conceptual framework examines the explicit actions and categories, the focus and levels of delivery for health promotion today. Firstly, health promotion is conceptualized across a continuum from downstream to upstream. What do these streams actually mean?
Here's a story to explain the continuum. Imagine that there is a village. Every day the villagers go to the stream and collect and use the water for many things, such as cooking and drinking. One day, everybody gets sick, and the villagers begin to investigate the cause for everyone's sickness. They discover that the water has been the reason why they've been getting sick. Also, the contamination mainly comes from the top of the stream and flows into the downstream. The villagers that drink the downstream have a hard time curing their sickness. Next, the villagers that drink the midstream water also have the same issue. However, there are some that are getting better and some are still sick. Lastly, those who live near the upstream are rarely contaminated at all. The reason is because they have already found the problem with the water and have found a way to cure it. And so they use the cure and put it in the stream from the top of the stream, which ultimately helps the whole village from getting contaminated from downstream to upstream. So how does this apply to the framework for health promotion? Let's see how.
Firstly, the downstream of the framework for health promotion looks at disease prevention. Disease prevention is a procedure through which individuals, particularly those with risk factors for disease, are treated in order to prevent a disease from occurring. Primary prevention, action undertaken before the occurrence of risk factors. Secondary prevention deals with early detection. The chances for positive health outcomes increases. Tertiary prevention, in the action to prevent recurrence of the disease. Usually this action is alleviate chronic disease or increase the quality of life and life expectancy.
Midstream are the determinants that influence the number, severity, likelihood, and type of diseases that affect the person. What are these determinants? As outlined in this slide, these are mostly social determinants that include the opportunity to have access to health education, being able to develop knowledge, understanding, and skill development. These fall under communication strategies and health education and empowerment approaches. What does that mean? Firstly, health information is being able to gather the data related to a person's medical history that includes symptoms and diagnosis. This will help medical professionals or governments to develop new strategies to target diseases in the communities. Behavior change campaigns. These campaigns follow a specific sequence that moves the target audience from awareness of an issue towards a behavior resulting in a specific health outcome. To ensure a campaign is effective, it must be adaptable to the context of the community it serves. Health education and empowerment is the access to quality health education and gaining the knowledge and empowerment of living a healthy lifestyle. People that have access will be understanding of their circumstances and develop a skill level of disease prevention that will enable them a healthy lifestyle. It is unfortunate that there is an unfair access to health education or health services. Poor and disadvantaged communities that have limited access to these services go through challenging circumstances.
In community and health development approach, the main focus is on engaging the community. spreading awareness and advocating healthy living by implementing community action. The next approach is infrastructure and systems change. This primarily looks into promoting health by making policy, legislations, and organizational changes. So back to the village analogy. The upstream, midstream, and downstream is a great way to represent and remember the framework of health promotion. The framework of health promotion is a great model to help society tackle the health concerns in any environment. Will you use it